Hi, everyone. If you can please prepare to take your seats. We're about to get started. Our next presenter is from Optek, Kevin Aebig, the CEO. Kevin has over 20 years of IT experience in multiple industries, protecting highly secure information, including over 15 years experience in enterprise-level solutions and critical systems within the healthcare and financial industry. Kevin has a passion for all things technology and a knack for explaining technical terms in simple and clear language. Optek Solutions is majority owned by Athabasca Basin Development, Kitsani Management, and Peter Bathleen Group of Companies, which represent 22 First Nations across northern Saskatchewan.
It sounds way more impressive than it actually is. So thanks for having me. I'm happy to be here. There's a little housekeeping before. If I break out in a sweat or run off the stage, I have a systemic infection. So bear with me here. We'll make it through. So as was introduced, we're a majority-owned managed services company. We're very young. We're 2 years old, but we were established out of Saskatoon with a partnership of Athabasca Basin Developments, which represents 7 communities in the far north of the province. And when I say far north, like a lot of people talk about Prince Albert, if you're familiar with Saskatchewan, as being like the north. Prince Albert's not the north. Prince Albert's like not even halfway up. So the company, those communities we represent in the basin area are right on the border. So, and we operate within that geographic area. And then our second partner is Peter Ballantyne Group of Companies. They represent kind of the northeastern side of the province, and we work within their communities. And then lastly, there's Kitsani Management, who represents the Lac La Ronge Indian Band, and we're very much in their community as well. So partly, one of the challenges of doing that is obviously providing on-site service. I was live streaming the event from home, which was really cool, by the way, that you guys did that, and saw that there was a number of other managed service providers here. And they spoke about the challenges of helping people in rural communities and providing strong technical guidance to those communities. And we've taken a different approach. We think we've kind of got a good game plan that translates well into bringing technical services to these remote communities, and also bringing opportunity, which I think is a huge part of this story. So to back it up, we get established, we get going. Like my bio that they mentioned said, I'm a big geek, and so I don't know people or things. I just know that if there's a problem, I want to solve it. So in that, we take on some clients, and they're like, well, we really want you to do some work up here in Black Lake, and I've never been to Black Lake. And I'm like, okay, well, I'll go to Black Lake. So I jump on a plane, and I go up to Black Lake, and while I'm there, they're touring me around the community, and I'm learning a lot about the people that are there, and I get taken to the school, and they explain to me what their infrastructure is at the school. And it's embarrassing. Like it's horrible. So, and I'm confused by this, right? I'm just a lowly geek from Saskatoon. I don't know what's going on, but this isn't the way it should be. So, okay, so we keep going, and we go and meet at the economic development office, and we start talking about within their community, and they take me to their band office and tell me that for the 20 people in their band office, they have 10 down, 5 up. So for the non-technical people here, that's the equivalent of a fax machine. Like when it comes to streaming Netflix or doing anything on Teams or online learning, it's just not good enough. So the infrastructure piece is one challenge. Secondly, to support these communities requires on-site help. Well, if you want to swap out a monitor and the price ticket to Black Lake is $2,500, that's a problem. That's a misuse of funding. It's not cost effective. The long-term benefits to those communities is that they just don't get served, right? So we came back and I was talking with my investment partners that obviously well engaged in this space, and they said, well, you know, what can you do? Do you want to start doing ISP work? No, I don't. It's its own forte. It's not mine. To those people that do that, good for you. Appreciate it. Starlink, big props. But that's not where I feel our strengths lie. So we came back and we came back with a different model. So the model is that there's underserved communities that need on-site technical support. And then the question gets asked, well, why don't you leverage people within those communities? Well, they don't have the education. Okay, well, why don't they have the education? Well, they don't have the infrastructure to connect for education, or they don't want to leave their communities to go and get that education. That's fair. Okay, so how can we solve this? So, you know, I'm a geek, so let's put together something that makes more sense. And for us, that was the Spark program. So we put together this plan, and we brought it to PAGC, the Prince Albert Grand Council, and pitched it and said, listen, we want to do this program and give it a try. And they said, okay, so what are the entrance requirements for this program? I said, a conversation. They're like, no, like, is it like an application process, or do they have to like submit a resume? Nope, it's a conversation. You submit an email address, I schedule you, and then we talk. Okay, I said, okay. So are you're gonna do this online? I said, no, I'm gonna go to their communities and I'll meet them and shake their hands in person. Oh, well, that seems costly. It might be, but you can either send me up to change out a monitor, or you can send me up once and I can train somebody to do it. What's more cost effective long term? Okay, that makes sense. So I went to all the communities. I met with 25 different kids that expressed interest into taking IT on as a career. I sat down with them over a course of 3 days, and we had conversations, and I asked them about why they were interested and why they were engaged and why technology was something that they wanted to be a part of. And some of the answers I got back were amazing. Like, these kids are like Xbox kids, right? Like, this is all they do. Like, they're like Halo kids or Call of Duty. But on the same token, they're like, yeah, I was setting up for Call of Duty and there was latency and I didn't like it. And I'm like, you know what latency is? Yep. Huh, interesting. And then I go and I do this and I set up my auntie's Facebook page and I'm doing all this stuff. Like, some of the stories that were coming, they didn't even know the scope of what they were doing. They were just completely unfearful and just wanted to learn more. So we're like, you're in all day, right? So the program itself, I am not a teacher. I saw SIIT in the house. Sharon Angus, you're awesome. And I don't teach. I can't build curriculum. That's not my forte. I solve problems. So what we did was we wanted to leverage an existing program that had a low barrier to entry and that was simple to support somebody along those lines. So we chose the Google IT Support Certificate. We thought it was a good way to get people into an entry-level career while they were being supported to deal with the barriers that they would face otherwise. So, and we do get asked the question like, well, you're using the Google IT Tech program. Why wouldn't they just go and take it themselves? Well, that's where the program itself is a little bit more special. So some of the barriers to entry I spoke of, there's infrastructure. Obviously, that can be solved through some clever means. But then there's other barriers. And, a lot of people don't like talking about those barriers. There's cultural differences between North and South in how people do business. And taking that into account as a company is important for us. So we're very understanding about those differences and incorporating a work culture that is more fluid. for lack of a better term. So, and to put it into actual details, we try and foster a community within our own company that is as a collective. We don't think of people as being individually held accountable. You are part of a team, a community, and within the scope of that, you succeed as a team and you fail as a team. And by doing that, we get people to work together more collaboratively, right? Which means they're supporting each other, which goes a long way to helping with those barriers, right? Secondary is obviously education. There's disparity within education through many nations. It's not an unknown fact. But those challenges need to be dealt with if you want to help people get into a comprehensive career, especially something like IT. So our approach to solving some of those issues was, one, making sure that we had the right sense of community within the company, and then two, incorporating that into the program itself. So we encourage the students to work collaboratively through that online schooling. The secondary piece is to bring in mentors that are understanding about those challenges as well, and that can help students while they're going through these programs one-on-one and explain things and show them real-world examples, which, by the way, has a ton of value. So if you're trying to explain somebody what a network is and how that looks and what the pieces are and how it interconnects, logging them into a client and showing them the nuances of that and giving them a better perspective of what that looks like is very, 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 very valuable. Especially when you start like technology moves fast, right? The idea of virtualization and cloud computing, we're very much into that, by the way. We're trying to help these students learn what's coming, not what's here. Because if you don't get ahead of the curve, you get left behind, right? So, so that mentorship piece is an ongoing resource for them as they start their careers, as they move forward, as they start working with us or with others, they maintain that relationship. We've had other organizations connect with us and say, we really want you to, hook us up with a whole bunch of people. I can't do that in good faith, because if I don't know that that person is going to be supported by somebody down the road, I'm setting them up for failure. And it's too much responsibility. For us, we're trying to give people careers, not jobs. So back to the mentorship program, it's shorter. We run it as 3 months for them to do the course alongside. Throughout that 3 months, like I said, they're matched up with mentors that work for Optek. And then through that, we also bring in Indigenous business leaders that we have connections with to come and talk about their experience coming up in a new career and a new job and dealing with cultural differences and dealing with the challenges they've faced. And we found that by bringing in leaders within that scope, it really helps the students connect with what's available to them and what that success can look like long term if they're willing to work hard and continue being focused on the end goal. So between those two pieces, we've had some good success. We've learned a lot, like anything new that nobody else has done. You get to fall flat a whole bunch. But that being said, I think it's a model that a lot of other organizations and companies could adopt and would be well suited to help them expand. And like, it sounds like we're doing like amazing things for the world and that, this is all, selfless. It's not. It's by no means. I am a business owner. I want to be able to be sustainable for the people that work for me. And for me, this is a talent pool. It's hard to find good talent right now. And there are some amazing people in really good locations that are well suited. Yeah, I'm looking at the SIIT folk. Sharon's trying to sell all of you guys, like they're amazing. I'm sure you are. But it's a like people say, you know, in the north, you know, we're mining for resources. I think we can mine for talent. I think there's lots of capability to find exceptional people that might not have had an opportunity before. So that being said, if there's any organizations or managed providers here or anybody along those lines that are interested in what we're doing and they want more information or model on how we use it, please feel free to reach out. This is something that's near and dear, and I think it provides a lot of opportunity and fulfills a lot of need. So, any questions with all the stuff I blathered about? Oh, that's perfect.
Questions?
Sweet, I answered it all.
Just trying to give somebody else a chance here.
No, because you're speaking my language. I manage an IT support shop, so what's your strategy for, once you've hired that talent and mentored it and fostered that, is it a challenge to maintain it and keep that talent as opposed?
Actually, no. We found that by supporting somebody through very challenging times, the loyalty we get back is exponential. So I would say my hardest workers are the people that have came through that program. They are excited to work, they're passionate about it, they're constantly craving more information, and as long as we maintain an environment in which they can learn in a safe way and not feel like they're failing, or not feel like they can't ask for help, it goes very well.
Are your services locked to Saskatchewan, or can you go to other provinces as well?
Right now, we're primarily Saskatchewan. We have some clients that cross over into both Alberta and Manitoba.
Okay, how about going into Ontario and maybe Quebec?
That's a pretty long view.
That is a pretty long
Fair.
view.
To put it in perspective, we're 2 years old. You know? Like, would I like to say, yeah, we can do that tomorrow? I was recently, I was talking to a big enterprise entity that I can't say the name of, but and they're a national entity, and they said, you know, if you wanted to scale this up and provide tier 1 services for our organization across Canada, could you do it? And I said, yes, but I want to make sure I do it right. Right? You don't want to rush this and burn people out or set them up for failure, or don't have the right procedures and policies in place to do it in a way that's well supported, you know? So I would like to say, yeah, we'll be there tomorrow, but you know, it's be irresponsible. So.
Because what I think you're doing is really nice, like being there for somebody else, right? That's super important. But where I work in northern Quebec with, I'm one of the ISPs up there.
Okay.
It's very hard to teach the students and the people I see every day, because it's just me and another person that sees them every day. Something like that would be super nice to bring into a school like up there as well. Well,
at bare minimum, we should have a discussion about what we could do to maybe help you grow that so that you do have the supports there.
Absolutely. Yeah. Absolutely. Thank you.
No problem.
I just want to have more of a comment than a question. I know Kevin very well, and at our organization, we provide third-level services, so often we'll buy hardware and software in bulk for our communities. And for this one particular community, well, it was more than one, but they provide, they don't have second-tier support, and they don't have a local IT. So we actually provided everything they need for a network. We provided that WAN service, the rack, UPS, switch, firewall, access points, configured them, deployed them, and then it was up to them to maintain that, because that was not our role to do that. And then this IT company that they went to, they actually duplicated all of that, including the WAN service, when we had already provided all of that. So the comment I wanted to make was, that was, they essentially got ripped off. They were all about billable hours and hardware, software sales. And I'm pleased that Kevin took that company over and they're transforming it into something that's very encouraging. So I just wanted to make that comment.
Thank you, Charles.
Hi. Based on what he was saying and what you said earlier is about not being an ISP, but setting up the infrastructure, is that something that you want to do more of, like just providing it and then possibly even, instead of becoming the ISP, at least training them to be the ISP?
Yeah,
because
so
that'll make a big difference in the communities to prevent that type of thing from happening.
Yeah, for sure. Like we try and go under a model that we're good at something, and that's all we're going to do. We're just going to be really good at that. So we don't do marketing services, and we don't build websites, and we don't do internet service provision. That's up to others. For us, we do managed services, and that is, we describe it as a rented IT department. So in that capacity, we would offload that, like you mentioned. So if there's a community need, we've installed Starlink, like I mentioned, a ton of places in the far north, because quite frankly, putting fiber through the Canadian Shield is really expensive. So that's a game changer as far as I'm concerned when it comes to most rural communities. But that solves a problem, right? And you can put a dish on everybody's house. That gets expensive, right? So now you want to try and have shared services. Well, that requires infrastructure. Charles is a good person to discuss how to do that in a way that's very efficient. It's not our wheelhouse. So for me, like to your point, encouraging and enabling people within a community is extremely well suited to serving that community, right? And for us, where we feel there's a long-term benefit is by maintaining that mentorship relationship. It's when that person on site hits an obstacle that they don't know or they can't deal with, right? They get to leverage us and remotely to be able to help get through that issue, right? So we've got a client far north. They're in Fond du Lac. They have infrastructure on site because they require it. They've got privacy and data concerns. Something happened. Server goes away. Their client data is safe, but not accessible, right? To get to Fond du Lac is not an easy thing. You fly in. It's way, somebody, if you don't know, look it up. It's way up there, right? We sent our guy over to do it, and it was literally like the janitor kicked a plug. It happens. It happens in urban centers all the time. People do silly things or accidents happen. Great. But if we would have had to send somebody up, Fond du Lac, you have to fly in, stay overnight, then you fly back. The meal costs there are insane. There's no Hertz rental. You have to get somebody to pick you up at the airport. Right? Like, this is a different world to operate in, and a lot of places are uncomfortable doing that, so that makes it even more expensive. You're paying for flight time, you're paying for on-site time. It's a $5,000-$6,000 trip to go plug in a server. That's a bad use of money. So.
Actually, I've heard that story, and I've been a part of that story
Yeah.
more than once.
Most of us have.
Yeah.
No more questions?
Perfect.
Perfect. Thank you.
Thank you.
Thank you so much, Kevin, for your presentation. So Optek was established in 2021 in Saskatoon, supporting the far north in the province. When we spoke earlier, he described himself kind of like a janitor, just cleaning up other people's messes. And I think that's how a lot of managed service providers feel, that you go in, and if you can just leave things a little bit better than what you inherited, you're doing a good job. He mentioned that if there's a problem, that he wants to solve it, and that often infrastructure in communities is embarrassing, and that it can be a challenge. So for an office of 20 people, he described a situation where they had 10 down and 5 up for their speed, and the CRTC wants to have 90% of Canadians at a 50-10. He discussed about on-site help, so how it could be up to $2,500 for a flight, and are you going to go all that way and spend that money to replace a monitor? So these communities do not get served, and it's ultimately about building capacity in community. And leveraging people in those communities who might have a lack of education. And he really sits down and just plans to have a conversation, like a meet and greet, and start to train for capacity. So 25 kids expressed interest in technology. That list, again, data silos or information silos. I don't know if all 25 of those children, these young adults, grab that opportunity, or if they can meet up with Sharon from SIIT, just to make sure that nobody gets left behind. Originally, they were just unfearful. They wanted to learn more. They were excited to work. They were passionate. They were willing to learn. So he really focused on the Google IT support certificate, which had a low barrier to entry, talking about cultural differences and incorporating a work culture that's more fluid, where you're part of a team and community that's supporting one another. Again, mentions about just the disparity in education, and that the students are working collaboratively, that mentors are brought in who can show real-world examples with hands-on training, and that it's a 3-month training program with mentorship and industry leaders. So it is hard to find good talent right now, and we need more talent, and for exceptional people who might not have had an opportunity otherwise to step forward into these roles. Up next, we have Orion Health, connection health information across the continuum care for an integrated person-centered record with Micahael Craig. Micahael Craig is the Vice President of National Solutions at Orion Health, with responsibility for promoting Orion Health solutions and partner solutions to the Canadian marketplace. He has led many of Orion's electronic health records, EHR, initiatives across Canada and in Australia from a sales and marketing perspective. Micahael has worked in a variety of healthcare roles over the past 25 years in Canada, Australia, and New Zealand, and has gained considerable experience in solution architecture, clinical requirements gathering, and clinical workflow mapping. Thank you.
Great, how is everybody? So that's me wearing a suit jacket. Since COVID, I don't do that too often. I don't know if everybody else has noticed that. This is when I had more hair too, but anyway, we won't dwell too much on that. Wanted to give you a bit of an overview of us as a company, and then I sort of go into the shared care record and how that fits and where that is. So as a company, there's sort of 3 main areas of focus. So we have sort of the people part, which we call Virtuoso. We have more of the care part, which is called Amadeus. And then down below, we've got sort of some of the back-end tools that I'll call orchestral. How these are used or what they do, or sort of when we talk about Virtuoso and the people part, this is you getting access to your health information. And really, fundamentally, what we do as a company is we gather information from lots of other sources and try and make a meaningful view of it for people or providers. So from the people, or from your perspective, that could be accessing lab results, could be accessing radiology report, something like that. Or even earlier on, it could be just helping you find a service in your community and knowing what services are actually available to you. Could also be using a diagnostic tool. So you can go in and try and figure out maybe if you've got a problem, what might be wrong with you before you engage with somebody. And it could be connecting up to a provider. From the care side, or the Amadeus side, that's where really we start to take information. And really, historically, there's been a lot of focus on hospitals. That's where a lot of the money has flown, on information systems within the hospitals, that sort of stuff. That's not really so much where we're focused. We're focused on bringing information from the hospital, but much more so from the community. And the community is a huge part of healthcare, but we often forget that. Most of actual treatment and initial diagnosis and all that happens out in the community. So it's really important that we start to gather a lot more of that information from the community and make it available for the providers. So we provide that sort of overview of the continuum of care, if you will, from both the community side as well as the hospital side. So I'll give you an example right now. One of the projects we're doing in Alberta is around bringing information from maybe a GP visit, or it could be a nurse visit, but primarily GP visit, that comes into the electronic health record, and that can be viewed by the provider. So if you showed up in an emergency department, they could actually see what has been happening and what you've been, who you've been seeing, what you've been doing out in the community. So they'll have a much better feeling much more quickly about things that you have been experiencing, and obviously apply some of that relevance to it. Orchestral part is just some of the back-end tools to help capture information and make it available. And depending really on the care setting where we are, we don't have to be that aggregator of all the information. If there's existing systems right now with information in it, we can just go out and actually connect up to those. A bit of overview of where we play in the world. I won't dwell too much on this. Actually, we are a New Zealand company, so our headquarters is actually in Auckland, New Zealand. And you can see where we're active in most of the world right now. I'm going to talk a wee bit specifically about Canada, so this gives you a bit of a feel for which provinces we've been in. And the electronic health record is something that has been going on in sort of different approaches for different provinces. And that's really because the way of our funding is set up and how basically each province decides on their health priorities. I think where we've gotten to over time, though, once again, is community now is really going to become a much bigger play in healthcare, especially now that we've got virtual visits. I mean, who really wants to go to a hospital, right? That's where all the money goes. Unfortunately, our politicians still talk about building hospitals. We shouldn't be building any more hospitals. We should be decentralizing as much of this as we possibly can. And that's where we're interested as a company, at looking at those opportunities where we can bring more of the community into healthcare, especially when you start talking about prevention, gathering that information that's going on out in the community and bringing it together. So I think if you think about, maybe you go to a couple of different care providers, or maybe you have your usual care provider, but maybe sometimes you've got to go out for specialized services. I'm sure we've all had that experience where nobody knows what's been happening in different care settings, right? You show up maybe outside your community into a hospital, they want to start from scratch and try and gather all that information. Although it's available in another system, they just don't have access to that information. That's where we get involved in trying to centralize all that information and bring it forward. So, that's really where we've been focused on. So we grew up around creating these electronic health records for specific provinces. There's no reason why there has to be a provincial barrier and why this information can't go over the barriers. We're a bit constrained in some of the privacy details, But ultimately, I think we're going to have to get there. And once again, much of what you're going to be doing or interacting with is going to be happening more in the community as we go forward. And so that might be in communities that cross borders, and that's the sort of area where we'd like to focus more of our time and attention on. Capturing that information, making sure that you have access to it, making it available. So it really doesn't matter which system originally captures it, and we don't provide all those first line capturing tools. We do have some tools on our own, but if you're, say, your doctor, or you go to LPN, or it's nursing or whatever, and they enter the information in the system, we want to get either a subset of that or part of that information, and that will be part of your health record. So that means it's available for when you need it, when you need to make it available to others, or for your care, somebody as a care provider needs to access it. So when we talk about the shared care record, really it's talking about this challenge. As soon as you've got more than one person involved in your care, how does everybody get access? How do they share that information? So this is where we as a company has been focused on sort of helping consolidate all that information from different sources and then making it available for different care providers. The other thing that we do around this is we risk actually with information overload, and that's a big problem as well. So based on your role, what you're doing, we can provide different views of that information. So a diabetic outpatient nurse has different needs than maybe the surgeon does, or different needs to just your GP, that sort of stuff. So we can provide more information, less information, we can summarize information, that sort of thing. So these are the sorts of tools that are actually going to be really important, because you show up somewhere for the first time, you've got the equivalent of a very large, heavy record. Somebody needs to try and read through and figure out what's wrong. That's where these tools come in to help actually focus you on what, say, the current issue is right now, what's relevant right now. Possibly breaking your leg in a soccer accident 25 years ago, it's probably not that relevant today to what your problem is. So it's important to have tools to actually filter out some of this stuff as well. So in terms of how the technology helps, we can actually gather information up. There's a bunch of different standards that are used in the healthcare context, HL7, FHIR, those sorts of things. I'm not going to dwell too much on that. But there's ways of actually receiving information. There's specific standards, and we're very much standards focused. Once you can receive all of that information in, then you can start to make sense of it. So the first step of this is actually what we call integrating with all of these different systems, bringing that information into, say, a central location, or it might be multiple repositories. But anyway, once we can centralize that information, then we can start to make views of the data. And that's really where we get to this, the continuum of care, crossing both community and hospital, those sorts of things, and provide those views. Trying to put this a bit more in perspective and how this would work is we try and share a bit of the resources as well as we go through this. So patients have a specific view, very much tailored for them. They're not going to get all of the same information that, say, a provider's not going to, that the provider's going to be looking at, et cetera. So you get workflow tools that get involved in this as well. So we have different tool sets that can, they're optional, but they can hold on, sort of just plug into all of this. So we've got things like e-referral, care pathways, we've got a medications repository tool and viewer. So a bunch of different tools, but that's where you get sort of the power of this. Once you start to consolidate the information, then you can use that to pre-populate things. So once again, it's trying to eliminate that step of you having to explain every single time what's going on with you. You can obviously use analytics as part of this. We use our tools. We make use of a lot of the commercial off-the-shelf tools that are out there. And then in the bottom, there's some back-end tools, as we talked about. It's interesting, determinants of health, there's been a lot of talks about that, but there's certain things that go on in your life that are actually going to determine your health care, access to food, access to different services, access to housing, all of those sorts of things actually help determine what is going to go into your health. So, you know, we have the opportunity now to try and gather those sorts of things as well to help understand, you know, if there is a long-term problem, what's influencing it. We have all of the historic clinical data type bits of information that can flow into here, clinical documents, and you're starting to see more and more from, you know, medical devices, connected devices, those sorts of things. So when you talk about hospital at home and all of that, that can all lead into all of this. So you start to consolidate all that data and then make use of it. And once again, this is when it becomes really important. If we started to take your, say, your Fitbit or whatever information from all of these different devices, not everybody who's involved in your care needs to see all that or wants to see all of that. But if we can provide a summary of that, it might be helpful. Maybe for some we just exclude it and they can go access it if they want to. So that's some of the challenge of all this information that we're going to get sort of hit with over time. But it can be really relevant in the right situation. And that's part of the challenge. So that's a lot where we focus on is how do we present that data, make it relevant, and allow people to either contribute or in some cases maybe they don't want to contribute, and that's fine because we can do different sort of filters and apply those sorts of gatekeeper type roles. So a few of the things that really compose this. So on the front end, we have portals. So we have both that provider as well as the patient portal. We have referral solutions. We have care pathways. And so care pathways can be specific around the disease state. We've done a lot around diabetes, for example, which can include things like reminding the patients when to do things. It could be teachable moments too, that, you know, your blood glucose is down, you probably need to have a snack or get some sort of sugar into you, etc. Medication management, helping people track what they're on, especially when you're on maybe 20 plus medications, maybe you're on a specific oncology protocol, that sort of stuff. Kind of confusing keeping track of all that, so we have different tools that can help with that. Touched on reporting and analytics. Collaborative work lists is another area too, and that's where we can create lists of patients and they can be associated with a care provider, or it could be that team. And that becomes really important too. We've got the opportunity basically to share these lists between different providers who are providing care. And that's really where a lot of healthcare starts to fall down, is just the trade-off or the handoff between, say, one specialty to another specialty or from community into the hospital. So we can provide that continuity of care, that sort of overview look of what's going on both in community and the hospital. You know, when we talk about what the actual benefits are, you can see some that are up here, but really the main thing is we're all struggling, right, in finding enough healthcare workers. And so it's really important, in my view, to have tools that can have the patient themselves help manage this, keep track of what's going on, be able to communicate what's going on. And conversely, it allows the different care providers that might be involved in providing care access to actually seeing what's going on and seeing what's relevant and trying to weed through a lot of information. More efficient care, obviously, will be a part of this. The other thing is we're trying to actually maximize a lot of the existing investments in technology. So instead of saying you've got to take a bulldozer through everything, remove it, and start from scratch, buy all new applications and all that, we're actually trying to gather the information that exists already. So we're an integrator, so we typically hook up to a lot of different systems. So, you know, the main focus is if you have a system right now that is able to produce clinical information, it's able to communicate or send it out, we can help capture that and then share that within this shared care record. I think our from different studies, et cetera, but both the patient and provider experience are greatly enhanced when they have access to the information and can quickly access it through our tools. And, a lot of talk, obviously, about addressing the gaps in health equity. We're providing the same view of that clinical information to people, to providers. We don't change it regardless of where you live, what your role is, what you do, that sort of stuff. So I think that's pretty important, too, in trying to address the health equity. That's actually it. I wanted to keep this fairly high level because I realize not everybody's going to be intimately involved in, say, healthcare, but hopefully gives you a bit of an overview of what we do. And I want to leave a bit of time for questions in case anybody does. But I think the main things and where we're focused on really is providing access to health information to either patients or providers, bringing it all together, trying to bring meaningful views, hopefully to empower people to, take more involvement in their care, because you have to. You can't really rely on the system. So maybe I'll just pause there if there are any questions or anything.
Hi, thanks very much. I'm with Health Canada, really interested in your solution, and I've met with Andrea and others on your team before. Just on the equity comment, I wanted to raise, do you have any examples of where you guys have been able to make good connections with rural and remote health organizations, specifically community centers? Because in our discussions with both provinces and Indigenous communities, we often find that these communities want to be able to procure these really cool solutions, but they often just don't have the capital to be able to afford these add-ons. And so I'm curious to what extent you might have, costing to be able to support these types of nuances, or if it's all just one set, or if it's modules that the health system would procure. Any extra detail would be helpful.
Yeah, no, it's typically been, obviously most of what's gone on to date, it's been procured at a provincial level, right? So we have, in Alberta, there's Netcare. Here in Saskatchewan, there's the EHR Viewer, which is our technology as well. So we've been able to, the electronic health record has evolved over time, and what happens is, as standards of practice change or new systems come online. So for example, in Alberta, they've been swapping out a lot of their hospital systems. They've been going to one large US vendor. That information is still coming through. It's transparent. It really, it doesn't much matter what that source sort of is. But I think where the exciting part is being more and more community engagement. I think basically what happens is the province has to make the decisions on what information is going to come in. And typically right now, there's been a big focus on engagement with EMRs specifically. So if you're familiar with products there's TELUS Med Access, there's also Accuro, there's a bunch of these different EMRs that are out there. We've agreed on a single type of data message that will come in and feed the system centrally. And so there's opportunities for that. I think where sometimes our hands get tied is, although we provide the platform, we don't get to choose who's going to feed it. And that's really the fundamental challenge. I think there's a lot of opportunities, and we're bringing in, we've got ophthalmologists involved now. We'd like to see a lot more community involvement. And I think there's a lot of opportunities to look at what we can do with, Indigenous health and bringing that sort of in. But we need to work through, unfortunately, the province, and that's part of the challenge. Any other questions? Okay, thank you very much for your time.
Thank you very much, Michael, for your presentation. Michael was talking about electronic health records, and he's from a company called Orion Health, which is based originally out of New Zealand. So I looked on your website, and the model that you're proposing is essentially 3 different products. The first one is Virtuoso, the second is Amadeus, and the third is Orchestral. So Virtuoso is the digital front door, and it offers things such as a patient portal, mobile response website, medication adherence, forms and surveys, and remote patient monitoring. Amadeus is the digital care record, and it's more so on the service providers. So that provides collaborative work lists, clinical workflows, a clinical portal, direct secure messaging, and medication management. And these 2 services for the client and the providers is based on Orchestral, which is really about health intelligence that looks at reporting and analytics platform, natural language processing, machine learning solutions, and data aggregation, looking at master data management. It also incorporates workflow tools for medications, repository and viewer care pathways, and e-referral, just to drill down a little bit more on what those services are offering. So the inputs for this system could be determinants of health, clinical data, the results from the pharmacy, et cetera, clinical documents, and medical devices. So thank you so much for your presentation. And our last presenter today is Deloitte. And so Deloitte came last year, and I'm really happy to see Jordan back with us. Jordan Sauer is the manager of Indigenous Client Services, based in Vancouver, British Columbia, Canada. Since joining Deloitte's consulting practice in 2015, Jordan has delivered technology strategies and transformational programs for public and private sector clients across Western Canada and the United States. In early 2022, he joined the Indigenous Client Service practice to focus on technology and digital advisory for Indigenous clients, working to improve the delivery of health and community programs and services through technology, process, and governance optimization. Also with Jordan is Dr. Lana Potts. So without further ado, I'd like to invite them both to the stage. Thank you very much.
Thank you, Cherish. And while we're just getting set up here, I'd like to start by first saying, okay, that's great, thank you. First and foremost, a big thank you to the Whitecap Dakota First Nation for allowing us to be here today. And of course, to all the event organizers, really appreciate being here. It's truly an honor to be back for the second year. I'm joined by my esteemed colleague, Dr. Lana Potts, who I will allow her to introduce herself in a moment here. Because we have the undesirable position of being the absolute last presenters, and we're between you and lunch, we decided to do a bit of a discussion here today, and then to open it up for a Q&A with everyone. But before I do that, for those who don't know me, Cherish did do a bit of a brief introduction. I'm with Deloitte, based in Vancouver. I've been working increasingly over the last few years on Indigenous healthcare projects, both the planning strategy and supporting the delivery, working between vendors and the communities to really make sure we're set up for success and long-term sustainability. But more on that. We're going to get into that in a moment. I wanted to turn it over to Dr. Lana Potts. Turn it over to you and just maybe introduce yourself, tell us a bit about your background, and we'll start from there.
Well, okay, itamaks kanatane, nitanaku sakwepi, natumtum tu pikane. And you're probably wondering, what is a Blackfoot doing in this territory? Well, I'm married here. My husband is Cree from the Muscopine First Nation in Soto, and it's a real pleasure for me to be here with you today. So I work in my community of the Piikani Nation, and I also work with Deloitte. It's a new role for me over the last few months, and I'm really excited to be here. I'll tell you a little bit more why I had asked to present to you, because everything that you're doing and what this conference is about, it's really about me. I become the end user, and I become the person who uses everything that you build, and I know nothing. I unplug walls. I have this black cloud of IT tech around me. If nothing works, it's because I'm in the room, and this is true stories. Margaret Cargard, who's sitting in the audience here, who I work with in Siksika, can attest to this. And so I felt it was important for really me to share a little bit about what it looks like in the end when I turn it on, and everything, the work you do, and all of this work and effort and consulting and building that you do, who uses it in the end? So I wanted to share some stuff with you. I work in my community. I've been successful to build a clinic. I set up my own EMR all by myself with me and good old Google. And so I think with that, I've had some pretty good success that I want to share with you, but lots of things that I've learned.
Perfect, thank you. Maybe we can get into that a little bit. What are some of the things you've done with your clinic, in terms of implementing technology to improve the delivery of health services?
So my introduction really into digital care probably happened years ago when telehealth was set up in community, and I started to get patients set up in front of a camera to see a doctor, to see a specialist. Then the pandemic hit us, right? And all of a sudden we had Teams and Zoom and all these platforms that I didn't ever have to use, and people still needed to see me. They still needed to see a doctor. In fact, we were one of the few clinics across the country that never shut down in Siksika, one of the other clinics that I work in. And we really put this effort into creating digital health, and I didn't know a lot about it. I probably did a deep dive into learning and realizing the benefit. So one of the most important things I learned was that I could be there for my patients. I could be there for our people. I can continue to provide healthcare. As we know, we have limited healthcare in our communities, but I started to see an opportunity of what do most people have is they have a telephone and they have an internet, and everybody knew what was going on in the news and virtually. And I've been able to engage in some programs that actually started to deliver healthcare in a different way. I've been part of the Alberta Indigenous Virtual Care Clinic, which is a clinic. We provide care to all 40 plus First Nations, Métis and urban Inuit First Nation populations across Alberta. So me as a little doctor in my little office on my reserve, I can provide healthcare like right across the province. I see people as far as Fort McMurray, Fox Lake, right down into the Kainai First Nation. And I do this, and we've been able to really create care. We've been able to get into community. But I learned what a difference this has, because through this, we bring in other providers, whether it's psychologists and other technologies to help people connect. And all of it's through internet and phone.
Right, thank you for that. Now, I can imagine with all the work you've been doing, you have some great firsthand experiences to share as to some of the barriers and challenges on using this new technology, virtual care. Maybe you could, elaborate on some stories or experiences and share that with the group.
Sure. So it all sounds really easy that I turn on a phone or people call me. Well, 90% of the time it doesn't work. And we realized a lot of it was through education and trust of technology. Indigenous people, we don't trust new things. And we know this in our community, and we're wary of who's on the other line and who's listening and who's going to hear these conversations. And health is one of the most protected things that we need to do. But I learned in getting people to get good connectivity is partially in building trust, but one was building relationship, letting people know what we're doing was safe, but also realizing they needed to be able to have that opportunity. We know connectivity is hard in our communities. We know people don't even have basic phones, that internet is slow. So we learned that's the big issue, that a lot of communities, we want to be able to provide care. We want to be able to set things up. A lot of communities don't even have a nurse. It's not even, I'm a rarity in the world, as you probably know. There's not a lot of me as a First Nations physician, but nurses are rare and healthcare providers are rare. And so really getting healthcare from me to the community is hard, because not every community is set up, such as Siksika or the community that I've set up in Piikani, because we need we need people, we need tech people. I learned in one community, they don't have a tech person. There's a tech person in the north who goes there once in a while to kind of helps to set up things, and everything's done over the phone, and that's been very challenging for a lot of communities.
No, that's for sure. Thank you for sharing that. That's something I've seen firsthand as well. The lack of support in some of the communities we've been working with. It typically rests on the shoulders of one individual. And healthcare, availability is so key. I'm wondering, if you could provide some examples. Like, how do we get around that? How do we? What are some quick wins or opportunities to sort of improve the way we're delivering service, getting service, and working with IT in the healthcare space? Are there any opportunities that you could share with the group?
So one of the most successful wins I've ever had with IT is I actually had the opportunity to speak at the United Nations. So during COVID, I spoke to the UN Council, and they called me and they said to me, we need to set up your system. And so what they did is they sent me this system in a box, and they opened it, and everything was coded, and I had pieces of paper that I opened, and it clearly showed me where to plug in, port to port. They asked me, what system do you use? And I took this and I thought, this is what we need in our communities. We need these very simplistic ways of where to plug things in when things are not working. The troubleshooting has to be very simple because we are end users. We are not tech people, and not just from doctors to nurses. So there was a story before of something was unplugged in a community. It seems as simple as that was my list. If this is not working, do 1 to 20. If 1 to 20 doesn't work, then call us. And these can be helpful in community. We're very fortunate. I work in Siksik. I see two of our champions here today. We have IT in-house, but a lot of times we don't. And by creating user guides, by creating picture user guides, culturally friendly user guides that allow this is what you see, this is what it should look like, that actually can save you money, because then we're not having to call you, we're not having to, we don't lose our time, but you're not losing time. Those can be very helpful. And really simple things of if this router's not working, you press these buttons, this is what to do. It seems simple for you, but for us that actually can be something we're wary of. We don't go in a room in one of our clinics because things might shut down, so we want to be able to be comfortable in that what's being created becomes easy for me to use the technology black cloud.
Thank you for that. That's absolutely, I think it would be very helpful to have, training and access to resources to help people troubleshoot is certainly the first line of defense we look to sort of make sure is in place. On the flip side to sort of quick wins, I think one of the other challenges I've seen that seems quite common, there's obviously a need for broadband connectivity, new technology, and there's always the knee-jerk reaction to run out and, procure that solution and stand it up and as quickly as possible. But the need to sort of step back and consider what is a strategy, what is a broader picture as we're making these investments. We're investing tremendous sums of money. Subscription services is a whole different way of budgeting and managing funds. From your perspective, how important is sort of strategy? And you see the role of strategy. Of course, and we're all aware there's fires to put out everywhere, and we don't have the resources. But maybe you could speak to just sort of how you see the role of strategy in thinking through investments in technology.
And I think that's one of the most important things I've learned. So I invested 20 years of my life to open this clinic in my community. It was not something that I could just do. But one of the things I learned along the way is really developing a sustainable strategy, creating something that's going to work long-term in a community. It's easy to, plug in, for example, I have Starlink at home. It's a great initiative. It's something that works for me rurally, but is that going to work for any community? And I think the lesson that I've learned is visiting the community, recognizing it's a community approach and it's community driven, that it's important to go in and sit down and visit and understand what are the challenges, what are the strengths, and how can this be done long-term? How do you build sustainability? And that is only done with a long-term strategy, setting up little goals. For example, when I plugged in my Acuro EMR, but how am I going to support that 5 years from now? Because a lot of nations have not a lot of money. We know this. There's very little capital and infrastructure that's put into even IT, into healthcare, into bigger systems. So by sitting with community and understanding what is real for them, what is going to look like 10 years from now, I was able to create something more sustainable in my community. We're very small, we're a little trailer in the prairies, but we know that we can build from that. And I think there's some really big dreams we want to do for our people. We want to improve our healthcare. We want to, live for the next 100 years. But we only do that by listening and talking and kind of stepping back and looking at what we're capable of now, but then how do we build forward?
That's great. Thank you. I think sort of a last question, which may be on people's minds. Why did you choose Deloitte? So in your role here, you're a doctor, you've got your clinic. What do you see as sort of the opportunity and the promise of your role here with the firm?
So I was offered this position actually last year, and it was a part of the nation building, and it was really, how do I make a bigger difference? I can do a lot in my life as a physician, and I have done a lot in my life as a person from my community. I'm proud to be a Piikani, but I wanted to do more, and I really wanted to start to address things from a systems level, to realize that what we need is more people at the table who are allying our causes, who are speaking our voices, and I need people there to be able to say, we can do this together. I have a little soapbox I carry around. It's really broken, and I'm kind of tired of standing on it, so I need more people there. And part of me in choosing Deloitte was coming a part of an organization who's doing work, who has the potential voice, who can actually, create networks of an awareness of what's happening at a community level. I pride myself on being from the community. I literally live in my community for a reason. I'm, from the reserve. I swam in the ditches. I did all those things that res kids do, and I'm still a res doctor. I call myself, the res doctor, because that's where my strength comes from. But I also want to see the world, that's where our strength comes from. We're not sick people, we're strong people. We have resilience, and we're here, and we're continuing to grow, and I want that capacity to build.
That's an amazing message. Thank you. Thank you. At this point, we've done a fair bit of talking. I wanted to open it up, see if there's any questions for Dr. Lana Potts.
Yeah. Okay. If you guys don't mind sharing.
Yeah.
Questions? Okay. I really got to make a runway for this next year.
Thanks so much, and thanks for sharing your story. This is wonderful. My background is as a hospital CIO, and physician participation is key to adoption. Is there any other forums like CMA or any other broader forums that you can bring into this discussion to help us get more adoption? Because to me, the secret to success is as your physicians and clinicians and nurses adopt and want more to deliver more, then IT gets pulled to support that. So just wondering if there's any other big forums that we can tie into some key messages to support the IT initiatives to support you better.
I think that's a really good question, and I really see a lot of collaboration happening around bigger tables, especially with Indigenous health, like Indigenous health groups that are moving forward, and having sat at tables with the CMA and with FEMRAC and with big health organizations. These conversations don't happen because often these systems are created without us, not with us. And I think the more conversations that happen, we're aware of how do we support you and how do you support us, and really knowing where we're starting from and what our needs are. And a big lesson to learn in Alberta for those to pay attention to is they've put forward Connect Care, and Connect Care is a great idea in concept. As a user, it becomes very confusing for me. It becomes very hard to use and how to integrate those systems. So I think that by chairing and partnering, perhaps even presenting at conferences to say this is what we can offer, what is needed in community, because health is in all communities. It's not just in Indigenous communities. We know this across countries, but Indigenous communities in particular have different health needs because health is not funded in the same way. We don't have the same infrastructure, and the IT and the technology, it's not that it's not there, but it catches up in a different way. So I think hearing the realities, I always say those frontline stories are really powerful.
Just to add to that, I'm not sure it's directly answering your question, but in terms of the opportunity from Deloitte's perspective, I think it's really, we have to consider it regionally, right? Healthcare is so different region to region. And of course, nation to nation, and learning what the needs are, really having that be front and center. But I really see the ecosystem of all the players, it's forums like this discussion, and it's connecting dots. It's putting the right people together, because I think we have the ideas and the solutions. The technology's there. It's building capacity. We heard about SIIT and some of the other initiatives here to build capacity, training in community. I think that's absolutely an area that we're very interested in supporting as well. So, and I think the bigger message is, if there's that additional capacity and support you need in implementation, that's the type of support Deloitte is looking to provide, to help think through, provide that capability where it might not exist. So we're much more than an accounting firm, which many people tend to think of us as. In fact, consulting is our biggest business in Canada. We touch all industries. Anyways, we can connect you to the right expert to talk to. So anyways, that's all from me. Any other questions? Yeah.
Hi, my name's Debbie. I'm with Indigenous Services Canada. Firstly, I wanted to applaud both of you and say thank you to both of you and to Dr. Potts for your role in your as a res doctor and also at Deloitte. My question is a very naive question. You said that there were very few of you, very few First Nations doctors. Are there enough? Just hearing what Tyson was saying about the CMA, it made me wonder, are there enough First Nations doctors, Indigenous doctors around to even make anything like an association?
There is an Indigenous Physicians Association of Canada, but when we talk about like First Nations doctors who were born and raised in the community, who come from the community, I don't even, I have more fingers than I do doctors that I can tell you. And one of the hardest things is actually working in communities. So to digress a little bit, that was the hardest thing for me to do when I graduated as a First Nations doctor, to say, I want to come and work in a First Nations community. By choice, it wasn't something I did as I couldn't get a job anywhere else. By choice, I wanted to go home. And the only community that was set up to do it in Alberta at the time was the Siksika, and I'm always grateful for Siksika, who, offered me a job, and I work there, and I've invested there, and they've invested in me. And this is one of the challenges not only you see with technology, but also with getting talent and really training people to be able to come and do the work. So we need more of us. If any of you are ever interested in medicine, or in healthcare or anything, like, it's possible, tell your cousins or yourself or your brothers, it's possible to do it. That's just, my other soapbox message. I'll come back. I don't mean to digress, but yes, there needs to be more of us, I think, in all facets of industry.
Thank you.
Yeah.
Thanks very much.
Any other questions? I know that you're all raring to pack and head home, and I really appreciate your time and listening to me today, and it's been really interesting this morning. I've learned a lot, and I'm really grateful to be here and to take home. One of the things I want to take home is how do I get my Starlink to work a little better, because I have had it for a few years. So yeah, thank you. Any other questions before we close? No? Great. Okay, so I wish you all safe travels home. It was a pleasure for me to have space with you today, and I look forward to continuing conversations down the road. Take care.
Thank you.
Thank you so much to our esteemed speakers, particularly to Dr. Potts. My apologies, I did not have your bio. So I just wanted to say that Dr. Lana Potts is Blackfoot from the Piikani Nation, and her husband is Cree. You are an incredible mentor as an Indigenous woman and a physician, and you have the ability to inspire the next generation of Indigenous doctors. So I just hold my hands up to you in appreciation for your knowledge. And Dr. Lana Potts is from a First Nations physician, medical doctor, Indigenous health, and First Nations expert. Dr. Lana Potts, CCFP, was a family physician at the Siksika Health and Wellness Center near Calgary. She was a founding member of the Aboriginal Wisdom Council, a provincial board that advises on improving health outcomes in Indigenous communities, and she's currently working in a full-time role assisting as a consultant with Deloitte Canada. She mentioned that the UN Council sent her a kit for setup in her clinic with labels of where to plug things in. And so end users need basic instructions and IT troubleshooting on how to reset equipment and do just basic tech support 101. Opening the clinic in her community was a 20-year process, and that any solutions need to have long-term sustainability, and it really has to meet the needs of the community. And so it's about relationship building. Nations are cash-strapped for infrastructure dollars, and Lana came to Deloitte because she wanted to have a bigger platform, work on nation building, and have more of a larger voice across Canada to help us have an Indigenous perspective in healthcare. She also mentioned about being from the res, and I'm from the res too, so I'd like to see a show of hands of who's been swimming in ditches. Yeah, Slough Girl Summer. So she mentioned that we're strong, resilient people, and that we have capacity, and we continue to build. Connect Care in Alberta is a good idea, but how do we interconnect that with something else that I heard? And that Indigenous health is funded differently, and frontline information is critical. So thank you again, Doctor. It's a real honor to meet you. It's very inspirational to see women taking these roles, and particularly Indigenous women. So shout out to Sharon as well. Yeah. So that concludes our session. We are going to have lunch, and we also have closing remarks. So I don't know if we're going to have closing remarks before or after lunch, but it is lunchtime. And so I'd just like to encourage everyone to stick around, enjoy lunch, and network with one another. I'm really looking forward. I hope I get to see you again next year. This conference is always a highlight of my year, and it's incredible the technological advances that have happened over the last year. You know, the introduction of AI and ChatGPT and BARD and Copilot and the development of low Earth orbit, you know, that we are really seeing technological advances happen at an accelerated rate. And kudos to all the IT professionals that are working very hard in health centers across the country to ensure that we improve the standards of health for Indigenous people across Canada. We're just going to give closing remarks, and yet again, it has been such an honor to be at NIITA and to be with each and every one of you. I always garner a lot of information, and I appreciate the networking and relationships that I'm able to build while I'm with this group. So first, I would like to just pass the mic to Jeff Niles. Then we'll also have Charles Bighead to give closing remarks. And finally, we'll have a closing song at 1 o'clock by Chris Standing.
Good afternoon, folks. I'm going to keep this short and sweet. I know that folks have to leave shortly. I did chat with some of the organizing group, and I think we're going to change the name of the symposium to the Jean-Marc Symposium. As you know, throughout those 3 days, he's taken upon himself to ask questions. So the next one in 2024 will just actually be him. He'll make the presentation and ask the questions himself. So on a serious note, but that's the whole thing about NIITA, is that engagement. It's that opportunity to spend time and network. It's key. It's part of actually what we do. And I saw that throughout the 3 days, coffee breaks, lunch breaks, throughout our time. So that was fantastic. I just want to applaud a few people. Pam, Patrick. There are others. The folks who spent time actually doing all of our meals. The young lady outside. honestly, the young lady outside who's amazing. Amazing. And also all of you guys. We do it all for you, and it's extremely important. I'm going to talk personally. It's amazing. It's just simply amazing watching people talk and network. And for 3 days, I have no idea what they're talking about, but it's working. It's working. I want to highlight a person, a mentor, someone I've known for maybe 10 years or so, and she is retiring. So it's Margaret. I know she doesn't want to be highlighted, but honestly, it's amazing. There's another thing I want to share is all the assistance that has been shared actually with me, and when I say me, I'm not an I guy, okay? So, and with us, from Tribal Hub to Nova Networks, Tricycle, and others saying, how can we help? So we're going to go back and rethink where we're going, and we need your help. So you have any thoughts, any ideas, not just for this symposium, but for where we're going. We have an idea, but this is I think it's a family. I really do. People share so much information, and and I think we need to plan. Other than that, I really think it's an opportunity that we have. And one thing, which I'm in awe, no one asked me for any money. I made it 3 days without anyone saying any money. So this is super great. Yeah, I don't know. Yeah. Super. So I want to wish you all the best in your travels. Spend time with your families, and we'll see you in 2024. Not sure where. We'll certainly let you guys know. And please, as I said last year, spread the word. This is important. And also, we will share. I'm saying this, Pam, so I don't know. We will share all of everyone's emails and contact information as well. So after this symposium, you will have everyone's name and contact information as well. So after that, all the best, safe travels, and I think Charles is up for to express a few words. So thank you.
Well, thank you. I wasn't scheduled to give a closing remarks, but here I am. So I think there's two groups I'd really like to thank. First, that big industry, those tech experts. It's really, really thankful for that. You take a genuine interest in, coming here and giving more than what you're being asked for, and that's not forgotten. I can tell you that for sure. It's not forgotten. And then there's the First Nations group. All you guys who had faith in this event and making time to come out. You must have had a positive feeling to take the time to travel and the costs and get away from your communities and families. So thank you too. And I want to thank all of you because, we always wanted to keep this grassroots, and something we did different this year was invited those students from SIIT. And without those two groups I just mentioned, I think they're leaving this place very inspired to go all in on IT. So thank you very much. Thank you to this community of Whitecap again too. They're doing a lot of amazing things. There are Dakota brothers. A lot of us here are Cree, but we're all NIITA, and so thank you too to this community for welcoming it and hosting this event. And the last thing I want to say is, this NIITA organization, it's just touching it's like the tip of the iceberg. That's all it is. Once you start talking, networking, you discover something that didn't exist here, or, and you can see that, although this is a national event, we haven't even touched what's going on in the different regions like Alberta or the Far East, so we're just touching the iceberg, and there's a lot of potential for a Canadian version of a tribal hub and all the wonderful things they did down south, our American cousins. Okay, well, thank you. Hope you enjoyed yourselves.
Hi, we'd like to invite Chris standing. Thank you so much for being here for the closing.
All right, I know you guys had a long 3 days probably, so we'll probably kind of have it nice and short and sweet. We have a dance performance for you to end your week with us here at Dakota Dunes Resort. And we want to share a little bit of our own culture here from Whitecap. Dakota people, we've always had this dance. This is the Wachipi, and then we brought this up into Canada. And a lot of our relatives down in the US have been doing this for a long time. Some of them for over 150 years. There's one of the communities called Sisseton Wahpeton community, and they've been going for over 150 years. So it's this dance, this pow dance, this demonstration is something we can share with our guests and the public, and share a little bit of our song and dance and our culture. So we're going to get into the first song, and then I'll kind of get into more explanation about the dance and the style and the regalia. And so you're welcome to take pictures, take video, your Snapchat, your Instagram, your TikTok. I think we got a good signal here, right? Yeah. I got a quick IT question. So I got my phone, right, and I'm just wondering, how do I make sure my ex isn't following me? No, just kidding. I was trying to think of some last time I was up here. I was like, had a Zoom question, right? So yeah. Still have one of my exes for sure. No, just kidding. Whenever you're ready, Elmer, we'll get into that first song, and White's here from Whitecap, Dakota First Nation, to share a little bit of his style, men's traditional.
Hey,
All right, round of applause for song number one. There's actually a powwow coming up this weekend here at the Saskatoon. The SaskTel Center, Federation of Sovereign Indigenous Nations, are having their celebration at the SaskTel Center where they have hockey and concerts and all that. So most likely if you go check that out, you're around this weekend, you'll see Wyatt there, you'll see Elmer, he'll probably be singing as well. I'll be there checking things out and visiting and hanging out with relatives, right? Go do some snagging. No, just kidding. Yeah, and also for Dakota people, this is something we've been doing for a long time, and even the grand entry is something kind of new to us. But we've always had these dances, especially the men's traditional. We started picking up the grass dance a little bit later. And then other dance styles too, like the men's fancy, the women's traditional, women's jingle, women's fancy, the men's chicken, and then there's all kinds of other dances that other tribes have brought towards this kind of performance and way of life. So it's really good. And I know for our Dakota people, we have different songs for different kinds of dances. For the men's traditional, there's at least 3 or 4, 5 different styles of songs that go with this style. And to say the men's grass, there'll be maybe 2 or 3 or 4 different kinds of styles of songs. But that first song you listen to, it's a straight song, almost like an intertribal beat. Pretty much every dancer will dance to that. Like if you go to a grand entry, you'll see that straight song. It'll be a straight beat. Even the intertribals will be a straight beat. But sometimes there'll be a different switch up of the song. And not just in powwow, but also for our ceremonies and even when we eat, when we drink tea, there's all kinds of different songs for everything that we do for Dakota people. In some communities, especially in Wyatt's community in Manitoba, in my kids' community in Sioux Valley, they have songs for all those kind of things. When we have settings and we have funerals and things like that, and sometimes we'll put our Dakota name in those songs, whether it's a memorial song or if it's an honor song, things like that. And there's veteran songs. So drum's really important for us, and these songs are important. So yeah, any questions right now before we get into the second song? And we're going to switch it up a bit. I think Elmer and Wyatt agreed to a different song for a second song. Any questions about anything about Elmer or Wyatt or the powwow style? Has anyone been to a powwow? Raise your hand. Anyone dance here? Any dancers? Any dancers here? No? Yeah, you dance? What do you dance? Oh, women's traditional? Yeah. Does anyone have a dance from their own culture, or maybe they yeah. Anyone else? Anyone play music? Yeah. Is anyone a drummer or guitar player? Yeah. Fiddle player out there? Anyone play piano? Yeah. Let's do some jigging or get some fiddle dancing going. Yeah. Well, I know for a lot of us too, this is our traditional way of dancing, but we also enjoy fiddle music. We also enjoy live music, live bands. In my family, they're into pretty much everything. They're into the powwow. They're into singing and dancing. My dad and them have a band as well. Plus, they go to powwows. So we like to dance and celebrate and have fun, right? So we'll get into that second song, and I think that's a different kind of beat. We'll switch it up a bit. Song number 2.
Hey,
All right, round of applause for song number 2. And that second song, that was the Sneak Up. So it's kind of a storytelling song. Sometimes they're showing about a hunt, or they're showing about a battle, right? So the dancers will kind of tell that story. And if you notice on that third verse at the end of it, it kind of like they touch this center pole. If you ever go to a powwow, especially like this weekend, you'll see the men's traditional dancers, they all touch the center. If there's no center pole, they'll all just kind of do it together, and then they'll spread out and they'll dance as hard as they can. It's really awesome to see. Like, it gets your adrenaline pumping, gets the crowd going, and it's like, wow, we used to be super warriors. Let's go attack Saskatoon. No, just kidding. Let's go. I don't know more. No, just kidding. Let's do a flash mob. No, just kidding. But no, when you see this live, it's super awesome. Especially you got like 40, 50 dancers. They all do it at once. They all start doing their war choir, their whooping and everything, and the crowd just goes nuts. It's real awesome to see. And yeah, there's powwows still going on. Like, just a couple of weeks ago, there was one in Prince Albert at the Northern Lights Casino. They got their powwow back, and Dakota Dunes Casino will be having their powwow coming up, and I think in January. And there was one last weekend, I think, that Wide went to. He's in Red Deer, Alberta. And these guys travel out through the summer, and I know they've been to a few powwows here in Saskatchewan and Manitoba. And myself, too, I've traveled out into the States, into Minnesota area. And mostly the powwow season is in that summertime, and it's outdoors in the powwow arbor or in some kind of open space, right? But now you'll see them kind of moving indoors into halls, into basketball arenas, hockey arenas, into gyms, all kinds of things like that. So people have been celebrating quite a bit. And even in Saskatoon, there'll be a lot of school powwows, high school powwows. It'll be like kind of like a one-day session, things like that. And it's really cool to see in our city, in Saskatoon, that it's growing and it's helping the kids regain their culture, especially if they're like second or third year urban, that at least they've gravitate to some part of their culture. Then they'll start to get back into other parts. Maybe it's on the land, maybe it's the language, and maybe it's drumming or singing or beating or learning their language, learning about the hunting and things like that. So this is a good way for people to get back into their culture. It's the first thing sometimes that they see about their culture is the powwow dancing, the teepee, and hearing the drum inspires them, right? So just want to share a little bit about what I know about Wide Brown here. He's from Whitecap Dakota First Nation here, and he's also works with Adventures. He helps rent the e-bikes and does the stargazing, Indigenous games, and sets up the mini teepee, the big teepee. He does a lot of work with us at the hotel. And he's also a really good dancer. He's been performing for us for a while, and also the community and all over Saskatoon area. So his regalia represents where he comes from. He's in Dakota, so his regalia is in Dakota design, and from his family, helped him put that together. And yeah, he'll be dancing this weekend here at the SaskTel Center. And then I got Elmer Tatus is here. He's from Poundmaker First Nation. I've been working with him for like over 10 years. I worked with him in Wanaskewin, and he does also singing lessons for schools and kids. I believe at the Friendship Center. He's done work with White Buffalo Youth Lodge, and he helps a lot of young people get started in the power singing and get them used to the drum and break out of their shell so they can learn to sing and help the community, right? So it's we always call upon Elmer whenever we can. He's real professional. He's on time. He looks good, dressed good. He smells good. Nah, just kidding. And we actually have another performance later for Discover Saskatoon. There's a bunch of board members from Destination Canada coming out for a VIP dinner at 4 o'clock. So they'll be doing this again. So I think we might have time for one more song. You guys almost ready to wrap it up? Did you guys eat already? Yeah? Yeah? Yeah. You guys ready for one more song? Yeah. Yeah. One more. Come back next year. Nah, just kidding. Yeah. So yeah, they're going to mix it up again, different kind of song. And after this, you're welcome to take pictures with them, or a group picture, or a selfie, or ask them some questions in person. And that'll be it for this afternoon. Hope you enjoy the last song. Applause for the final song. So hopefully you enjoyed your stay here at Dakota Dunes Resort at Whitecap, Dakota First Nation, Wapahaska. We'd like to thank you for being part of the community here and helping us out too with your business and supporting what we do out here. And hopefully we'll see you back and we'll see you again. Dokshta ke. All right.
Thank you so much, Chris. I really appreciated when you opened our plenary and you spoke about the maps up on the 7th level of the Dakota territory. And so it was really beautiful to go up there where the pool is and actually see the maps of different Dakota territory. And again, Elmer, thank you so much. It's very powerful and healing to have the sound of the hand drums. You know, First Nations people are not one homogenized group. In the Pacific Northwest, it's much different. Regalia is white and red, or black and red, and has cedar accents, and we dance as a group, and we just have the girls in the back kind of swaying. We make all the men get down really low, like warriors, and dance in the front. So, and Wyatt, thank you so much. It's an honor to see young men involved in their culture. Culture is healing, and it's such an honor to have you share powwow culture with us and Dakota culture. So thank you again. And on behalf of NIITA, I just want to wish everyone really safe travels home, whether you're traveling by car, by air, or by foot. My name is Cherish Clark, and I look forward to seeing you in 2024. Safe travels.